my name is Enos and welcome back to my channel. This is Work and Wonder. I talk a lot about the mental health Osce, anything nursing, scholarships, a whole lot more. So if you're a mental health nurse and you are preparing for your Osce exams, again, this is the right channel because it's only this channel that we talk about the mental health nursing Osce. Over the past weeks, I've had a lot of people emailing and also commenting that I should do a video on the IM injection, which is one of the new skill stations that they added to the mental health nursing Osce. I already have a part A video of it, which is more or less like an educational video and then introducing you to the skill. And this particular video, I'll try as much as possible to demonstrate it practically for you to know exactly how it is done. The IM injection station is 12 minutes, so basically you have 12 minutes to complete this particular station, and then of course you would have to go through all the steps that are elaborated in the marking criteria. You have whatever you are doing should meet the marking criteria, and if you do that, then of course you are going to pass. And usually in the skill station, there might be a human being sitting down there, but of course you are not going to inject the human being. There will be something that will be given you for you to inject it, for them to see exactly how you would have done it in real situation. So I have some items here that I tried as much as possible to purchase to do this particular video. That is why it has taken so long. So I've got this here, which is like a silicone. As you can see, it's like a silicone human being. So it's just like the texture of the human being skin, just that it is silicone. And that is what I would be injecting the medication in it. So in exam situation, you should expect, something like this where you'll be injecting it, because obviously you wouldn't be injecting anybody in the exams hall. Then of course I have my apron here. Then I have my 2 needles here, which I will be using. Then I have my syringe here as well, and of course I also have the medication here. So this is like an improvised medication, and I have some alcohol wipes too as well as I also have a plaster, and then I have this as my tray that I'll be using. So these are the items that I'll be using to demonstrate this particular station. And I must say that usually when I'm demonstrating this station, some people will come under the comment section and they're like, the station is 12 minutes, the station is 10 minutes, the station is 15 minutes, you exceeded that. Of course I'll exceed that. Like doing an intro like this, and even within this particular skill station, it's more like geared towards teaching. I tell you that you have 12 minutes to complete it, but when I'm doing it, in between, I try as much as possible to explain some things in between for you to be able to understand it. So yes, I'm aware that the station is so and so minutes, but when I'm doing it in the form of a video like that, it is more like educational. It is up to you to practice so that you'll be able to practice within the stipulated time, so that in the exam situation you will not be beaten by the time. So without wasting much time, I'll go straight and start the video. But today I am alone. I have nobody to respond, so the videos, these types of videos, honestly, is very difficult to make, because you have to kind of do the video, you pause, then you respond to yourself before you'll be able to move forward. So when you're watching the video and get to a point that looks like I'm stuck or I'm not talking, it's not because I don't know what to say, but because I'm waiting, because I have to talk, then I'll have to respond to myself, and then I'll cut that bit and then insert it in the video. I hope this makes sense, but then let's just go straight into the video and then we'll see what we are dealing with. So today, before that, I will try and read the scenario. The scenario says that Mr. Enosh usually comes to the mental health clinic every week for his paliperidone depot. Today he has come, it is 12 o'clock, administer Mr. Enosh's depot. As simple as that. So this is a patient who normally comes to the clinic for his injection, and today is a weekly injection that he gets, and today he's here, you're the nurse on duty, administer this patient's depot. So this is also like a community base. So we know that usually it's either a hospital base or it's a community base. So the patient has come to the community clinic, you give the injection, and then the patient will go back to the community or to the house or wherever the patient came from. This is not like an inpatient who is on the ward where you would have to give it. But you can also have a situation where you have a patient who is on the ward, and on weekly basis or 3 days or 4 days or 2 weekly basis you give this particular IM injection. But our scenario says that the patient has come from home, he's just coming to take his paliperidone medication or injection, and then he will go back to his house. As simple as that. Without wasting much time, let's get straight into practicing for you to see how exactly it is done. So I'll enter into the scene. I've checked for scene safety. The scene is safe for me and my patient. I will do a hand rub according to WHO guideline, which is palm to palm, palm to back, fingers interlace, fingers interlock, rotational rub of the thumb, of the fingertips, of the wrist. My hands are clean and dry to approach. Hello, good morning. How are you?
Hi, I'm alright and thank you for asking.
All right. My name is Enos. I'm one of the nurses who works here in the mental health clinic. I think I've met you a couple of times, and I wouldn't be surprised if you know exactly the reason why I am here. But then, before we even go on, can you please tell me your name and your date of birth just to confirm that I am with the right patient?
My name is Enosh Fragrance and my date of birth is the 5th of July 1993.
All right, so I have with me here Enosh Fragrance. The date of birth is the 5th of July 1993. Can you please confirm your address to me?
My address is a 3 Old Big House and the postcode is NE611AS.
All right, so the Old Big House 3, NE661 AS. All right, thank you very much. I can confirm that I am with the right patient. How have you been, Enos?
I'm fine, thank you.
That's fine. That's fine. So as I said earlier on, I'm one of the nurses here, and as you know, you have attended the clinic for your weekly depot, which is to be given here this morning. So basically, I would go through the prescription with you, and then I'll prepare the medication, and then we'll give the injection if that's fine with you.
Yeah, absolutely, that's fine with me.
All right, fantastic. But before that, are you comfortable? Is there anything that you want to tell me, or anything that you want me to know?
I'm fine, thank you.
All right. Are you allergic to anything?
Yeah, penicillin.
All right. And when you take penicillin, what happens?
Yeah, I get anaphylaxis when I take penicillin.
Fantastic. That has been recorded here as you are allergic to penicillin, and then when you take penicillin, you get anaphylaxis. And this will be taken into consideration, and we'll make sure that nothing that contains penicillin or its derivative will be administered to you whilst you are here. Is that okay?
I'm fine, thank you.
Right, thank you very much. All right, so in that case, I am going to go through your prescription with you, and then I will get the medication, and then come back for us to administer it, if that's okay with you.
I'm fine, thank you.
All right. So I have with me here Enosh Fragrance. Your date of birth is the 5th of July 1993, and then your height is 1.57, your weight is 74, and then your body mass index is 25.6. Your consultant is Dr. Richards. And then this prescription has been written out by Dr. Richards, and then his bleep number, his GMC number, his signature is present here. And then the next table is for me, that is administering the medication. So what I'm going to do is that I'm going to put my name down here as the person who is administering your depot today. So that is me, Enos. I have my initials, I have my signature, and then of course it's a community clinic. And then the next one is for the allergies, which you've actually confirmed that you're allergic to penicillin, and that has also been recorded here. Your doctor or your consultant, Dr. Richard, has also signed that, meaning that we are quite aware that you are allergic to penicillin. The next table is for the medication risk factors. None of the boxes have been checked, so you are, as far as this medication is concerned, you are not at risk of anything. Now, when we go to the next table is for the medication, and I can confirm that this sheet still remains for Enosh Fragrance. The next table is for your medication, which is paliperidone, 100 milligrams, and then it is a weekly medication. The route of administration is the deltoid muscle, which I'll be administering it into, and then it's to last for the next 6 months. and the instruction is an antipsychotic. And the doctor's bleep number is here. His signature is here as well, and his name is also here. This prescription is valid, it's legible. I'm happy to administer it. Enos, so I'll go and then get your prescription ready, and then I'll come back and we'll administer. Is that okay with you?
I'm
I'll
fine,
arise,
thank
I'm
you.
gone. If you need anything, don't hesitate to give us a shout, and then we'll come back as early as possible to assist you. Is that fine? Fantastic. Coming to the side of the cupboard, I'll have to do another hand rub according to the WHO guideline, which is palm to back, fingers interlaced, fingers interlock, fingers interlock, rotational rub of the thumb, of the fingertips, of the fingertips, of the wrist. And at this point, I have to put on my PPE. So I've got my apron here, which I'm going to put on. And usually these types of aprons, when you're taking them, you have to be very, very careful, because when it has a line for which you have to tear it through, if not, you will tear it and then it's going to take you a lot of time to get your apron on. Yeah, so I've gotten my apron on. Of course, I have to put on some gloves as well. The gloves also comes in sizes, medium, small, and large. So if you're not too sure of your size, before even the station starts, you can ask the assessor if you can put your hands in them, just to be sure that whatever size that you'll be putting on is a size. I wear medium, so straight away I'll put on my medium size. So the next thing is to cross-check my medication. So the name of the person or the patient taking it is Enosh Fragrance, the right name. Then the medication is paliperidone. I've got the right medication, which is the paliperidone. Now the dose is 100 milligrams, and I can see here this is 2 mils, which is equal to the 100 milligrams. So 2 mils is equal to the 100 milligrams. So the right dose as well I've got here. And then I can cross-check with it that yes, that is it. So 100 milligrams of paliperidone. And then the route of administration is the deltoid muscle. So the muscle IM, and then it is the deltoid muscle that will be administering it. And then the expiry date is the 11th of 26. It's still not expired. The lot number is 3346. And then this is to last for the next 1 week. So I have the doctor's name here, I have the doctor's signature here as well, and making sure that this prescription is valid, is legible. I'm happy to withdraw it. So I'll pick one of the needles, and then I'm going to open it. As you can see, I open it from the top, and then pick it up. Then I have 2 needles here. This is 1, this is 2. This particular one, I'm going to open it as well. Pick my needle and then my syringe. This is my needle, this is my syringe, and of course, I'm going to insert it. Now that I've inserted it, this is the medication. So I basically put it there, and then I withdraw every single thing, which is 2 mils. Yes, so I have withdrawn the medication, and I have exactly 2 mils here, which is equivalent to the 100 milligrams. So this particular needle is just for withdrawing the medication from the ampoule that it came with. So now that I'm done with it, I can remove this particular needle. Then I'll put on the second needle that I'll be using for the injection. So I'll just gently remove it, and then I'll now pick the second needle. So that's the second needle. Put it this way. So that's the second needle in addition to the medication. So I'll put this back here, and then I have my alcohol swab, and I also have plaster just in case the patient is bleeding. So I'm now going to go back to the patient side, and then we are now going to inject the medication. Hello Enos, I'm back. Are you still happy for us to continue with this injection?
Oh, yes, I'm ready for the injection.
All right. Before I continue, can you please tell me your full name and then your date of birth again?
My name is Enosh Fragrance and my date of birth is the 5th of July 1993.
So I have with me here Enosh Fragrance. The date of birth is the 5th of July 1993. Assessor, I can confirm that I am still with the right patient. All right, so Enos, I'll have the medication prepared here, which is a paliperidone 100 milligrams that I've already withdrawn here as per the prescription from the doctor. And then the site of injection is going to be your deltoid muscles. Which of your arms do you want me to use in administering this particular medication? I can see that the last week it was injected onto the right. Ideally, I'm supposed to go into the left, but it is a matter of preference.
I'll prefer the left arm.
All right, you want it on the left. All right. Can I have a look at the left, muscle or your left arm just to see that the place is clean enough? All right. So have a look at the deltoid or the site of injection just to make sure that there are no wounds, there are no lacerations, there's nothing that should prevent me from being able to inject the medication there. So I'm looking at the arm. I can see that there are no wounds, there are no lacerations. The site is clean enough, and then I would be able to use this left arm for the injection of this medication. So at this point, I'll be injecting it. So I'm going to now tilt the camera to my mannequin where I'll be doing the injection so that you see exactly how it is done. Yes, so this is the point where we are going to now inject the medication. In my tray, I have my medication which I've already withdrawn. Then I have a plaster here, and then I have an alcohol swipe as well here. So basically what I'm going to do is that this is the deltoid muscle that they have given us. They are saying that we should use this particular deltoid muscle to do the injection. So what I'm going to do is I'm still going to cross-reference with my medication, which is paliperidone. So I have with me here, this is the paliperidone injection, and it is 100 milligrams that I'm supposed to give. And then as I can see, it is not expired, it's expiring in 2026. So I'm happy to still administer this particular medication. So first of all, as I've already done that, but ideally I will look around the site of injections to make sure that there are no lacerations, there are no wounds, there is no cannula, there's not anything that will prevent me from giving the medication at the site that I have identified. Once I am okay with that, I'm going to pick my alcohol swipe, and then I'm going to clean from inward to outward. So you clean from inward and then you go to outward. Once you are done with that, you allow that to dry for at least 10 to 15 or 20 seconds. Then you can now pick your medication. Once you pick your medication, usually what you do is that you are going to stretch the skin. So you put your hands on one end and then you pull it to the other side. And then you're going to go in
90 degrees. 90 degrees.
Least 1 centimeter of the needle showing. Once that is done, then I'll gently, about 10 seconds, and then I'll inject the medication. Once I'm done with that, then I can now rapidly remove it. Then I make sure I leave the skin. Once I leave the skin, immediately as possible, this is going into the sharp spine. So I have my sharp spine here, which I have put that in. And then if the patient is bleeding, I'll make sure that I put a plaster on it. Please mind you, you don't have to massage the place. You don't have to massage the place. So as quickly as done, your injection is done. And then if there's a cloth or whatever is covering the patient's hand, you can cover it up, and that is your injection done. So now that you've done with your medication, of course, you need to now go to your paper sheets, and then you're going to sign at where you gave the medication. So today, I'll put my signature there, then I'll put the date, and of course, the time as well. Once I do this, I have signed that I have actually administered this medication. So hello, Mr. Enosh, thank you very much. I have administered this medication now, and the next date of administration is next week, Monday, because you take this particular injection on weekly basis. As you already know, if there are any signs of, or if you get home and then you are experiencing any adverse signs like dizziness, like you falling off and things like that, kindly let us know, and then we'll swiftly attend to that. But as far as I'm concerned, you are not likely to have any side effect because you've been on this particular medication for a very, very, very long time. Is that okay with you?
I'm fine,
All
thank
right.
you.
In that case, then thank you very much for coming for your injection, and I'll see you again next week. So at this point, I'm done with my injections. I'll quickly remove my apron. I'll take off my gloves as well, and then I'll do another hand rub according to the WHO guideline, which is palm to palm, palm to back, fingers interlace, fingers interlock, rotational rub of the thumb, of the fingertips, of the wrist. And my hands are clean and dry to leave. Yeah, so basically that is it for the IM injection. As I said earlier on, because it's just one person, it's very difficult for me to coordinate everything, but I'll try as much as possible to put the videos together to make meaning out of it. And yeah, basically that is it. If you have any questions, of course, you can put that in the comment section, and I'll make sure that I answer that as well. My name is Enos, and this is Work and Wonder. And then I'll see you in my next video.